Welcome to the Wellness Experience by Kroger. My name is Ryan Wolfington, and I am proud to work with four-time Grammy-nominated singer-songwriter Jewel in her efforts to bring physical, emotional, and mental health to the masses in a fun and inspirational way. Today, we have an incredible guest. Patrick Kennedy has been a United States Congressman for over 16 years and has been a mental health advocate, helping people get the care that they need. So Patrick, the theme for this month's summit is the holidays, how to create deep and meaningful connections with our families. And I know that, the Kennedy family is America's family. Growing up Irish Catholic myself, my aunts and uncles looked up to your family. And I have a theory that when they saw John F. Kennedy become president, they thought, well, wait, if he can do that, I can do anything.
That's right.
And as a result, we have a family full of entrepreneurs, and the Kennedys are like a big deal in our household. Jewel and I have a youth foundation called the Inspiring Children Foundation. And about, 2007, 2008, my Uncle Vince and Aunt Alicia brought our kids to DC. And your father, he must have spent hours with our children, not 1 year, but 2 years in a row. And he brought them in his office and he had the dog there, beautiful dog. And he would sit back and tell stories about what he felt was the most meaningful part of his career. And he said the civil rights legislation. So you had a very unique opportunity to work hand in hand with him. He was in the Senate, you were in the Congress. What would you say, looking back, is the most meaningful legislation or work experience that you had when you were a politician?
Well, I think that notion of civil rights was consistent throughout his brothers' lives. President Kennedy was the first president to go on national television and talk about civil rights as a moral issue. He said, who amongst us would be willing to trade the color of their skin and be content with those who counsel patience and delay? Obviously, back in the 60s, there was a lot of politics that said, really don't rush this civil rights thing. You're only going to alienate your base. Of course, the base for the Democratic Party back in the 60s was the South. And of course, whose base is the South today? Republicans. That's not a coincidence. And I can remember my father telling me about how President Kennedy himself was pretty, non-tuned into this issue. Like many, he just grew up knowing what he knew, and he didn't know what was happening to people who just by dint of the color of their skin led a very different life, one that wasn't guaranteed the same promises that his life was simply because of his skin being white. So my father, I remember him telling me about his brother watching the television and seeing the fire hoses turned on protesters during the early civil rights days, and just being so disgusted just as a human being. He said, I've got to speak to the nation on this. It obviously had been boiling for some time, but there was an event that had really sparked it. And my father had President Kennedy's original statement, which he wrote in longhand. And it was pretty impressive that it was so much of this was just his gut. He wanted to speak out and say, like, who amongst us would be willing, be content with those who say, wait, now's not the time. I thought it was so incredible. And then, my Uncle Bobby carried that fight forward with Dr. King. And then my dad really did the legislating around the movement, so President Kennedy kind of showed where to go. And my dad spent his nearly 5 decades in the Senate really meticulously going after, how do we better implement the Civil Rights Act? How do we pass a Voting Rights Act? Because he was there then, and he was an instrumental part of that. How do we amend the Voting Rights Act to make sure it takes into account this, this, and this? How do we get the Fair Housing Act? How do we get the Fair Employment Act? How do we get the Americans with Disability Act, which of course is another extension of civil rights? And then here I come. And I was the sponsor of the Mental Health Parity and Addiction Equity Act, which in my view was kind of the next generation of this fight, because it said that people with brain illnesses shouldn't be treated any differently by their insurance companies than they would be if they were being treated for a medical or surgical issue.
People of color, much smaller percentage of people are getting the mental health care that they need. But giving kind of some basic tools is helping mitigate either existing issues or issues that are just starting, especially now with COVID. I know you've done a ton. Are you seeing that mindfulness and meditation and exercise and family connections and those things is the research showing that makes a difference?
Well, there's no doubt that your ability to mediate your own emotions and feelings by first identifying those feelings and then not reacting to them, that's just a powerful tool. When I'm a person in long-term recovery, which for me means that I haven't not had to drink or drug since February 22nd, 2011. But I go to daily meetings and I learn from others who are also in sobriety, how do they cope with stresses in life? And it's not hard to figure out who the winners are and what they are doing to be successful. And they're doing all of those things. They're exercising because we know what a big stress reliever, good exercise, aerobic exercises. They do, 12-step recovery, if you are active in it, is essentially cognitive behavioral therapy. It's you overriding your feelings to do things you don't feel like doing and then getting stronger as a result. And that may seem like so elementary, but no one gives us the guidebook for life, unfortunately, in school or even, as parents. And so we have to learn things that just make our lives a lot easier to live if we learn them earlier in life than if we learn them later on. But either way, it's good to know them. And no doubt that prayer, meditation, exercise, healthy eating, definitely enough sleep. And good social interaction and that takes work. All of those things take work. And of course, there's a reason why there's something called the 7 deadly sins, because people for a long time recognize what are the pitfalls to our existence as human beings. And when you map the 7 deadly sins of pride, anger, greed, envy, lust, gluttony, and sloth to your life on a daily basis, you can start to see where you're falling short and work on trying to improve those instincts in you that, if not quelled, can really lead you astray. And if you're in recovery, you get to understand how you are absolutely required to work on all of those every day, because if you don't, you're in jeopardy of needing to drink and drug in order to quelch the angst that comes from not acting by doing the next right thing in life.
I mean, listen, I actually had a complete meltdown in my 20s, and there's a lot to work on. Let's just say that. And Brian O'Neill, who you know, was a huge mentor of mine and helped me, get my act together. And I actually went to Hyannisport and I learned how to calm down. I didn't know how to relax. You can be a workaholic to the point I couldn't relax. And you brought up this really good point about excitement. A lot of people think of excitement as a positive. We've been partnering with Dr. Blaise Aguirre at Harvard's McLean Hospital, up where you grew up.
Yeah.
He prescribes meditation, and he's really big on the CBT and the DBT. And, we've found we're getting kids after they've already tried medication, after they've already been through the mental health system, and they didn't have an outcome. It was kind of scary for them because they're thinking, wait, the experts gave me these pills. They took me to these hospitals, and I'm still messed up. What do I do now? When yet a lot of times they're not doing the CBT and the DBT, and the meditation and these other, even lifestyle changes. They're not giving them that education, which is free. It's just teaching them. So I really think your videos are amazing. I really like what you talked about, going from one addiction to the other, because I personally think we're all addicted, especially now. I call the young like generation addiction. They're being raised, being taught how to be addicted to social media, but to some extent. But it is interesting. I've been addicted to a lot of things, and workaholic and drugs, and it was interesting how you get a hold of one and then another one tries to pop up. Remember that game?
Whack-a-mole, yeah.
Whack-a-mole, whatever, and they all try to pop up. So learning how to not let that sneaky little, just even working out can be an addiction if you overdo it. And I think that's really insightful, because right now, I don't know, what are the statistics? Is addiction increased in society? I mean, our experience on the ground is it's dramatically increasing. Have you seen that from the big picture?
Well, there's no doubt we already had an epidemic prior to the pandemic.
Yep.
And deaths of despair, as they were kind of euphemistically understood, really suicides and overdoses, are literally lowering the average life expectancy of the average American. We're making great progress in tackling cancer and diabetes and cardiovascular disease because we put a lot of money after those problems. We've spent trillions of dollars going after cancer. Thank God, all my family members have had cancer. But all my family members have also suffered the effects of addiction and mental illness. And that cost to that illness isn't always well managed through the numbers. It's an untold cost. And in that way, it means it's very easy to hide that cost and then not to galvanize the kind of political support you need to go up against that challenge and take it on and really address it. So we've been kind of obscuring the real dimension of the suffering and the loss of life, not just from the physical loss of life, but literally people who are basically offline, if you will, for whole years and years of their life, caught up in mental illness or addiction. Addiction is a mental illness, but and in those years they'll never get back. And you ask them about, their life, and it wasn't their own because you were held hostage by your disease. So, but how do you organize a political effort around that can garner any kind of sympathy? Because even though this affects everybody, there's still such inherent antipathy towards people who have these illnesses. And the reasons are pretty clear. I mean, we all know, in addition to ourselves, for those of us who've been through it, others who've had it, and it's very frustrating. The way you manifest these illnesses is not in a very sympathetic way. You're annoying, you're angry, you're bitter, you're resentful, you're selfish and self-centered. I mean, this is not a crowd you want to go do a march for, because and that for that reason it's been very difficult to get a public health response to these illnesses, and to also put together the funding in terms of brain research that'll better help us identify who's higher risk for certain types of stress. And so that we then know, just as part of your medical record, do you have a family history? Like they do that for every other area of your health. Why don't they do the family history on mental health and addiction? They don't do that. Maybe now they're starting to, but it's probably spotty at best. If we take that mindset, we can apply it to these illnesses, and I think have demonstrably the same, if not better, effect. What we're fixated on is the pill. We're thinking that that's what medicine is. We are in the midst of a revolution, which I think illustrates that medicine has its place, but it's changing the way we think by, as I said, going back to this kind of behavioral therapies that can help us along with all of these new tools. So while social media has been a real challenge to disconnecting people as opposed to connecting them on a human level, There are benefits to social media in terms of what technology can do to allow you to stay connected to your network.
That thing is very powerful.
Great.
I was really blown away by that.
I appreciate that. It's very good.
But anything we can ever do, please reach out.
Will do.
All right.
All right, man. Thank you.
Appreciate your time.
Stay healthy today. Just today, brother.
I will.
All right.